Today we will discuss importance of external quality assurance in the clinical laboratory, why it is required. See, what is the expectation of clinician from us? They want accurate report, that accurate report within reasonable time frame. How we can ensure accuracy? One thing is we participate in internal quality control. With internal quality control, we get confidence about precision. If we are testing multiple times the same sample, we are getting similar result. With external quality assurance scheme, we get confidence about accuracy. Our result is close to true value. So both are important. So today we are discussing this external quality assurance scheme. In this, we get one sample from some outside agency and we test that sample in our laboratory and we submit our results to that agency. They perform some statistical analysis and inform us whether our results are comparable to peer group, other people who are participating in that EQUA scheme or not. What is the purpose? Why we shall have quality control plan? A document strategy, you are developing a procedure of your IQC, of your EQUAS, because we want to detect an error in our analytical system before it is detected in the patient sample. We want to minimize the failures. And if something is not within acceptable limit, we are detecting that, we are carrying out root cause analysis, and we are implementing appropriate action, and then we monitor that action for its effectiveness. Purpose is we want to reduce the occurrence of errors. We want to give appropriate quality results to our patients, and whatever information we are conveying to our clinician, that is meaningful for any decision to be taken. Quality control procedure is required, which is including both IQC and EQUAS. QC tools. Tools means in our statistical analysis, these statistical formulas are called statistical tools. Whatever we use, see, we are using mean, SD, CV, LJ charts, in EQUAS, Z score, or SDI. These are our QC tools. So we have to see what all we are going to follow in our laboratory and how we are following it so that these are effective. We develop QC, then we see whether it is effective or not. We monitor that QC. If we find something which needs some improvement, then we are improving on that aspect. This is how we manage our quality control, whether it is IQC or EQUAS. So as we discussed, what is the purpose of EQUAS? This tells us about accuracy, and IQC, that tells us about precision. Precision is how close results are to each other, and EQUAS is how close our result is to true value. When you are participating in EQUAS and you are getting information, your results are not comparable with your peer group, with the other laboratories who are following the same EQUAS, then you look into it. First you are identifying problem, then you are carrying out root cause analysis, and you are finding out what is the reason of this and how we can improve this. When you take the action, when you do the root cause analysis, you discuss with your friends, your peer group, you discuss other people, you attend different conferences, then it increases your awareness about the approach to this external quality assurance. And there is no subjectivity because a external body is analyzing so many different results of different laboratories. They are analyzing your result also. So there is a objectivity. This equals participation. This is the requirement of ISO 1509, which we use for the development of quality management system, which we use for the accreditation of our medical laboratory. In this, it is mentioned under clause 7.3.7.3, equals participation. What we do the analysis and we submit our results. Then our results are compared with other laboratories and we get information. So now what is important? One thing is wherever a national EQUAS program is available, enrollment in that program. And whatever samples you are getting, you are submitting your result, you are participating actively. It is not you are only enrolling and you are not carrying out or you're not performing adequate action on those EQUAS samples. And when you're submitting your result, you're getting the results from the EQUAS provider, then you are evaluating your performance. And it is important. See, what is the purpose of participating in EQUAS? We want to detect an error in our analytical system. So this EQUAS sample shall be processed by the same person who is performing patient testing. It is not like that you are saying, oh, this senior person will perform this EQUAS test, otherwise all those patient samples are analyzed by some other person. So this way you not be able to detect the error in your analytical system. See, external quality assurance scheme may be quantitative, may be qualitative. For quantitative, like your glucose, for your hemoglobin, for your urea, hormones, tumor markers. These are quantitative analysis. You are getting a discrete value. A histopathology diagnosis. A sputum for AFB positive or negative, HBsAg positive or negative. These are qualitative tests. You are not getting discrete values. So how this EQUAS shall be analyzed? In this quantitative EQUAS, we will discuss. In qualitative, what happens? We go by the majority. And to consider a qualitative EQUAS effective, whatever result EQUAS provider is getting, at least 75% should be in favor of one particular diagnosis. If suppose you are sending sputum for AFB slide to 100 laboratories, 60 are saying it is positive, 40 are saying it is negative, then you have to reject that particular cycle. At least 75 should be in favor of one diagnosis. If suppose 90 are saying sputum for AB positive, 10 are saying negative, so it is okay. Then 10 has to see why they are not able to see AFB in that, or 90 are saying negative, 10 are saying positive. So what exactly they were observing, which they are considering as AFB positive. So that way, in qualitative, we go by majority. In quantitative, we use Z score. Z score or standard deviation index. These are same thing. Calculation is same. And whatever EQUAS scheme you are selecting, you have to see, if possible, it is checking all three: pre-examination, examination, and post-examination. And here remember one thing, if suppose you are in a EQUAS system, you are uploading data on their website, and there is an error in the uploading of data. After that, you're correcting, you're sending corrected information So remember one thing, this is post-examination error on your part. Analyze correctly why this thing happened in your laboratory. Same thing may happen to patient sample also, patient result also. And whatever aqueous sample you are using, it should mimic patient sample. And some clinical challenge. Whatever diagnosis, it should impose some challenge to the laboratory. Or quantity to test in the borderline range. So that way, how we are actually behaving in these situations. And there is a standard for aqueous, ISO 17043. It should fulfill the requirement of 17043. All these things they have mentioned, all these requirements in standard ISO 15189. In case of quantitative aqueous provider, they select target well. Sometimes we call this as group mean or assigned value. There are various ways of assigning value to a aqueous material. One thing is, aqueous provider may say we are using reference material or calibrator. It has fixed value. So we are using that as target value or assigned value. They may say my laboratory is reference laboratory. I will test in my laboratory and your results will be compared with that result. In another situation, they may say we will develop an expert group of 5 laboratories based on their past performance. And we will take their mean. Results will be compared with that. Or they say, we will take group mean. We will take the mean of all the laboratories. Whatever they are saying, this aqueous provider has to decide. And standard deviation is calculated by the results of all the laboratories. The one thing is selection of this target value, how they are selecting. And if there is any issue, when they are developing aqueous scheme, or participant want to ask something, so all these things are clarified. Aqueous material should mimic patient sample, and they provide instructions to laboratory what exactly they are supposed to do with that aqueous. And when they get the result, these aqueous provider, they perform some statistical analysis, and after that, results are communicated to the laboratory. PT provider is sending PT samples. PT means proficiency testing. Aqueous or proficiency testing, same thing. They are sending these samples to the laboratory. Laboratory analyze and send results to the PT provider. Then PT provider evaluate those results and they develop some PT performance report. That PT performance report is sent to laboratory. They receive report, they analyze that report. If they find there is any outlier, something which is not within the acceptable limit, then they do the root cause analysis and they take appropriate action on that. In the management system, laboratory has to see who will handle these PT samples. Even you are receiving through courier, who has the responsibility to keep these at appropriate place, who will reconstitute, and who will analyze aqueous samples. And we discussed earlier also, these aqueous samples shall be done by person who is running patient sample. So that means you treat aqueous sample same as patient. You run those samples, whatever results you are getting, record those results, and When you are getting results from the EQUAS provider, you are finding any outlier, something which is not within acceptable limit, you are doing the root cause analysis and take appropriate action and monitor your action. In the next cycle, also observe now whether it is within acceptable limit or not. And whatever information you are receiving, because when we are analyzing the result, we are analyzing our performance. What is important? These, the information which you are getting from the PT provider, that shall be discussed within the laboratory with people who are involved in running these samples and discuss with them. If something is outlier, after proper action, now it is within acceptable limit. Why this thing happened in our laboratory? Is it related to reconstitution, or there was some clot in the aspiration tube, or some other thing? So now, what are the precautions to be taken so that it is not happening again? And in our laboratory to work at some standard and for the harmonization, everybody is working in the similar manner and same person is working in the similar manner over a period of time. What is required? Training, training, and training. In quantitative EQUAS, this PT providers, they provide us Z or standard deviation index. These are same thing, but it is better if we are using this term Z score because this is a standard statistics in proficiency testing. In this, they have mentioned Z score. So it is better we are using the same term. If it is between -2 to +2, this is acceptable. If it is between 2 to 3 or -2 to -3, it is warning signal. If it is more than 3 or less than -3, it is action signal. One action signal or two consecutive warning signals indicate intervention. Now, what I mean to say with this, now we will see this in little detail. See how Z score is calculated. Lab result minus assigned value divided by standard deviation. Lab result is your result which you got within your lab. We discussed there are various ways of assigning value to a PT material. So whether it is the reference material or expert group of laboratories or group mean or reference lab, it is decided by the EQUAS provider. Suppose assigned value is group mean. And standard deviation which you are calculating, which PT provider is calculating after receiving all the results from all the participants. Now suppose standard deviation for glucose is 2. Group mean assigned value is 100. A patient result is 102. 102 minus 100 divided by 2. 2 divided by 2, 1. And what this is saying, -2 to +2 acceptable. So that means it is acceptable. Suppose in a laboratory, result is 95. 95 minus 100 minus 5 divided by 2, 2 minus 2.5. This is warning signal. You have to be very careful in the next cycle. Or if a laboratory result is 108, 108 minus 100 divided by 2, 8 divided by 2, it is 4. That is action signal. It indicates the intervention. You have to find out why I am getting so much variation as compared to my peer group. So that way we have to analyze. Keep record of all the results of corrective action which you are taking in case of outlier. But there are certain limitations of the platelets. Sometimes these are affected by variables which are not related to patient sample, and it will not detect all the problems in the labs. There are many problems. One thing is correctness of the result. PT is detecting at a particular time, proficiency test. You are communicating result telephonically, you are collecting sample, suppose it is not collected from the right patient. There are so many things, so we have to consider all those things. But PT is a useful tool with you if you are acting fairly in the PT, so it give you confidence. But sometimes it may not be able to detect problem with pre and post examination procedures, as we discussed. Suppose a class is not available. What will you do? Exchange sample with other laboratory, or in some situation where that is not possible, split sample in two or three. It is analyzed by different sample. It is analyzed by different persons, and then you are comparing results. Or you are using some reference material as sample, as PT sample, and you are analyzing that reference material whether you are getting acceptable result or not. Ultimately, QoS is a system for objectively checking the laboratory performance using an external agency or facility. So there is objectivity. Subjectivity means everything is in your hand. You're finding this is not acceptable, you're modifying that. But in this, objectively, you're submitting your result. You don't know whether the result which you will get will be within the acceptable limit or not. And it is better all laboratories are participating in EQUAS because this is telling you about the accuracy. An EQUAS sample must be treated the same as the patient sample. See, when you participate in EQUAS, you are spending reasonable amount of money in buying this EQUAS. You are using your personnel to run, you are using your machine, you are using your reagents, you are using so many resources. So it should serve some purpose in your laboratory. It is not like that because otherwise accreditation body will raise some and see that we have to run this. Find out the purpose. And the person who is running a course, if there is some outlier, do the root cause analysis, take appropriate action. The person shall not be punished. And it is a learning process. Over a period of time, when you know that these are the possibilities of variation, you're taking care of all these things. So you feel more confident in your laboratory. It is some sort of educational activity, and it is improvement in the laboratory activity. The very important component of the quality management system.